Yes. Hello all. A very good morning. As Sir told, I've learned these exercises from Dr. Sharangapani. So that's what we are going to discuss. So I'll just start the presentation now. Yeah. So as Sir told, today's webinar is about micro-correctional exercises. I just took a small liberty to change the topic little bit and made it as pain and its correction. Because unless and until we appreciate pain, we won't be able to appreciate the comfort which is brought by correction. Okay, so we'll see what is pain and we'll see what is correction and what like correction brings comfort. We'll see the whole process. So that's what Tai Chi is for you. Uh, Now, what is the need of this thing? The way Sir told that we all know there are large number of patients who are suffering from musculoskeletal pains. Let it be back pain, let it be neck pain, let it be knee, ankle, wrist joint pain, shoulder pain, frozen shoulders, many complaints. So stats show that only back pain is the largest cause of absentees at workplaces. Not only that, but it's a leading cause of disabilities worldwide. So you can see the extent at which it is spread. So it's a kind of it's a point of concern, right? At the same time, these people are, as it is not getting maintained properly, at the same time new patients are popping up every now and then, right? Currently I've seen school going kids, like small kids are also coming down with back pain because they were carrying lots and lots of weights on their back when they were going to school. Now they are coming down with neck pain because they are sitting in front of computer for a long time, using tab, using mobile for a long time. So number of patients is also increasing day by day because of their postural let's say a wrong posture throughout these years. So again, that becomes a point of concern. Now, approach of society. That is a very important point because there is not much awareness in our society right now regarding pain. Pain doesn't become chronic in one day. It presents itself like a mild discomfort here and there, on and off. We ignore it. Then it becomes slightly severe, but it is again on and off. We ignore it. Then it becomes like pain. It doesn't remain discomfort. It becomes pain, but it is again on and off. We keep on ignoring it. If it becomes thoda sa more severe and it becomes continuous, we pop a pill and get back to work. So as I written it down over here, pain pill work, that is our kind of approach at society, that if pain happens, pop a pill and get back to work. So slowly that mild discomfort becomes chronic pain throughout the years. And people come, yeah, present to the clinician when they are in that stage of severe pain to chronic pain. They don't come when it's mild and when it's manageable on their own. Why they come? Because pills stop working. 25 वर्ष पेन किलर्स घेतलेले आहेत, आता पेन किलर घेऊनही इफेक्ट होत नाहीये, मग काहीतरी वेगळं शोधा. That's when they come to the clinician. That's when they come to the correction point. So that is a kind of complete ignorance society is working on. That needs to be corrected. They have to think that it is okay, it is mild, but still it is pain. So we have to correct it in first place so that it won't become chronic at the end of let's say 10 years, 20 years, like this thing span. At the same time, approach of medical faculty as healers, all of our approach is also very important over here. As homeopaths, we have a very beautiful concept of constitutional medicine to prevent recurrences or cut down the recurrences, right? But other than that, I guess all of us are behind treating these entities as diseases to be cured or as diseases to be treated. They are not the diseases to be treated. They are the maintenance problems. Just like we maintain our cardiovascular system by doing cardio activity like running, jumping, swimming, etc. We maintain our musculoskeletal strength by doing certain strength trainings or weight training. We maintain our flexibility by doing yoga and flexibility exercises. We maintain our mind vitality by doing mental this thing, breathing, meditations, and etc. Likewise, exactly like that, we have to maintain our spine by doing certain exercises and following certain postures. So this is a kind of a small shift in our approach is also needed. That's what I feel. So this is the need, I guess, according to me, is for micro correctional exercise is now. So now we'll see why is it a wrong approach. Now, as homeopaths, we have learned that pain is body's message, pain is body's language to tell that something is going wrong. So immediately correct it. Listen to the body and correct it. But more than correcting, what we rather than correcting, what we do is we kill it. That becomes a wrong approach. It's just like somebody is telling you, coming and running towards you and coming and telling you that somebody is stealing something from your house and you're shooting that very person. It's exactly like that. We are killing the pain, but inside whatever body is trying to tell you that this thing is going wrong, it is remaining like that. That's why it's a wrong approach. Okay? So now we'll see what are the causes for musculoskeletal pains, or let's say chronic pains, all kinds of chronic pains. The biggest cause is wrong working postures for a long time. Let it be IT people, generally they come down with neck pain and back pain. If it's housewife, they generally come up with back pain because they stand for a long time, deliveries happen, that becomes a cause for you know uh, imbalance between abdominal muscles and back muscles. If they are like overweight and they are let's say working at home for a long time, they come down with knee problem and plantar fasciitis problems like that. So wrong working postures is the largest cause of chronic pains throughout. Second largest cause is abdominal weight gain. That is the important cause for lower back pain, osteoarthritis, and ankle pain, or let's say any joint pain for that matter, but mostly lower body related. At the same time, if the patient is heavy, obviously it is very difficult to manage their fractures, to make them immobilize and everything. So abnormal weight gain due to anything, let it be a healthy weight gain, let it be due to overuse of steroids, let it be due to any pathological condition inside the body, but abnormal weight gain is going to lead to any chronic pain in lower body. Then third cause is sports injury or other traumas. Like sports injury में आता है ACL tear, PCL tear, fractures, other traumas like road traffic accidents, falls, etc. Others constitute a very small amount of patients. That is like if there is actual pathology to that joint, like if there is a neoplastic growth or there is a cyst growing adjacent to that joint, so that causes a pressure symptom and that causes numbness or tingling or some other altered sensations in the body. That is a very small amount of patients who present with this. Fifth cause is still there, but I didn't dare putting it over here in black and white, is a mysterious cause, because many a times patient, sometimes like not many times, very few times, patient do present with severe pain. They can't sit, they can't walk, they cannot lie down, they cannot do anything. They come up with severe pain, nothing is working, but their x-ray and MRI pictures are completely normal. Above I told you ki abnormal weight gain is the problem, but their weight is also in normal range, but still they are having severe pain. So those are kind of mysterious patients. Nobody knows why they are getting such a severe pain, but they are there. So that mysterious pain is also a cause. So now we'll see body. Now we consider, like as homeopaths, we consider body as a whole, body and mind as a whole. But today's topic is physical correction, so I'll just take body as a mechanical entity over here. As you can see, on left side we can see a healthy knee. On right side you can see a arthritic knee. Right now, on left side you can see there is normal joint space on both the sides. Medial joint space, lateral joint space is normal. There is no rotation. Generally rotation of tibia is also there in osteoarthritic knee, but you cannot see it on x-ray picture, which you can see on actual patient if you will see the knee as such. Right side knee is osteoarthritic, so the medial joint space is completely reduced, it's almost gone. Lateral joint space is slightly increased. Again, there is a medial rotation of tibia also seen in osteoarthritic patient, which is not seen in x-rays as such. So this is left side is normal, right side is abnormal. Now we'll see how we correct it. Okay? As I told you, in this case, there is medial joint space reduction and medial rotation of tibia, right? So the correction will be activating lateral group of muscles, which will increase the medial joint space because their tone will increase, and which will cause the lateral rotation of tibia. That's how correction is going to happen. It's exactly opposite muscle groups which we are activating. Now, what are those muscles? We'll see the muscles one by one. First is tensor fascia lata. Now, everybody knows it goes from lateral side of the knee, right? So, if you will activate tensor fascia lata, obviously that tone of tensor fascia lata increases, and that will create a normal space on lateral side, and that will increase the medial space to like that will expand the medial joint space. So that will help in increasing the medial joint space. That's how tensor fascia lata is going to work. Hamstrings. Now, why hamstring? Hamstring is the muscle which stabilizes knee joint, you can say. Hamstring is opposite to quadriceps. Quadriceps is, as it is a very strong muscle, very toned muscle. On top of that, on everyday daily activities, we use quadriceps a lot. So if we activate quadriceps more, obviously there will be more imbalance between the muscles. So don't activate quadriceps, activate hamstring. That will stabilize the joint. That's why making hamstring thoda more stronger or toned is more important in these exercises. Third is biceps femoris. Again, that is a part of hamstring, but why is it necessary? Biceps femoris will carry out a lateral rotation of tibia. That is its action. So that aspect, the lateral rotation of tibia, will be taken care of by biceps femoris. Fourth will be plantar arch. Now, why plantar arches correction is needed? As I told you, most of the times osteoarthritic knee is because of weight. Most of the times. Now, when the weight increases, obviously that weight comes to knee. After that, it comes down to feet, and the plantar arch gets flattened. It gets flattened on the medial side. When it gets flattened, obviously the abnormal pressure comes down to the medial side of the joint. So to correct it, we have to correct the plantar arch first, so that aspect will also be taken care of. That abnormal pressure which is coming up on the knee. So plantar arch should be corrected. And last but not the least, stretching of medial muscles. Now, why? Now, let's see. All lateral muscles are toned. We are activating it. Lateral rotation is also taking place. Everything is fine on lateral side. But if the medial muscles or medial ligaments are very taut, very tight, they won't allow that to happen, right? So if you'll give the stretch to medial side of the knee or medial ligaments, then they'll allow the medial space to expand. They'll allow the lateral rotation of tibia. So that's why we have to give the stretch on the medial side, and we have to make the lateral side taut. We have to activate the lateral side. So this was just an example of how we calibrate the muscles surrounding one particular joint. Likewise, similar correction takes place in any other joint where you calibrate the muscles surrounding that particular joint. Let it be lower back, let it be neck, let it be shoulder, let it be wrist, let it be ankle, any joint. Okay, so that was just an example. Now comes the most important point, that is point of correction. Now, as homeopaths, we all are like not know, we actually use this concept of minimum dose in homeopathy. What is minimum dose? Minimum dose is just enough quantity, which is just enough to trigger the adequate response or the desired response in an organism, right? Now, same concept is applicable in correctional exercises. Now, in correctional exercises, correction takes place at a point where the patient applies just enough strength to trigger relief, to trigger comfort. Okay, let me repeat. Correction takes place at a point where a person applies just enough strength to trigger comfort. We'll take an example of headache. A person is suffering from headache. Indicated remedy is belladonna. Indicated potency is 200. If we give belladonna 30 to the patient, obviously he's going to have no effect. It is going to be inadequate. If we give belladonna 1 m to him, obviously it is going to aggravate the problem. Exactly like that, if the person is applying less strength than required, it is not going to see, it is not going to show any effect. If it's going to apply more strength than required, it is going to cause aggravation of pain. So this point of correction is the most important point in these exercises. That's what patient get confused about most of the times. Now, how to know whether we are applying correct strength or not? Now, as I told, the point at which pain disappears and comfort appears is point of correction, right? We'll take an example of Setu Bandhasana, or let's say bridging, which is the commonest exercise given to lower backache, bending both the knees and lifting hips up. Now, in this, at the level of 200, she should stop lifting, because that's where her correction is taking place. That's where her pain is disappearing and comfort is appearing. If she'll go beyond that and reach 1 M point, that is going to aggravate the problem. If she'll go down, if she'll stay down and stay at the point of 30, obviously that is going to inadequate. That is going to be inadequate, and that is going to cause, like, that is not going to be any effect on her back pain. So 200 is her potency. She has to stay there. So wherever your pain is disappearing and your comfort is appearing, you have to stay there. Don't go beyond that point and don't stay below that point. That is the most important quality, or let's say characteristic, of these exercises. Okay? Now we'll see one more point in which homeopathy and exercise goes hand in hand. That is individuality. Now this point of correction or point of comfort changes from one person to another. Two people are doing the same exercises, A and B. One person is lifting till 1 centimeter, he is feeling comfort, he's staying there. One person is feeling that, okay, I'm feeling comfortable by lifting hips up by 1 millimeter. Both are right. Exercise looks same. It is the same exercise, but the body's message changes from person to person. Both are right. So that is the main point I wanted to tell here, that don't copy exercises. Exercises look similar, but stay where you are finding your comfort. So listen to your body. That becomes the key factor over here. All right. Now, now we'll come to role of breathing. It is again one of the very, very important aspect of correction. Why? Now, as I have written over here, breathing is the bridge between mind and body. If the breathing is going well, your mind is relaxed, your body is painless, you feel good. If your breathing is haywire, it's disturbed, your mind is disturbed, your body is painful, or your body is disturbed as well. If the breathing stops, person is dead, right? So breathing becomes very, very important. Now, why abdominal breathing? Uh, all must have seen a baby in its sleeping posture, right? When a baby sleeps, only his tummy goes up and down, right? Because he doesn't have any tension to his mind. He doesn't have any stress. He doesn't have any fear. He is a relaxed person. He is a happy person. So whenever he sleeps, or whenever he is doing anything actually, but while sleeping it's more seen. Uh, he's very happy. He doesn't have any tension. His breathing is abdominal. When we were babies, even our breathing was like that. We used to do abdominal breathing. We used to be in abdominal breathing throughout. Slowly, when we started facing the difficulties, the tension, the stresses, the anxieties, the fears in life, slowly, the breathing started coming to the chest. It shifted to the chest. Whenever you'll see, if you are in tension, if you are in anxiety, or if you are disturbed mentally, if you'll observe, your breathing is happening through chest is moving, right? So by breathing correctly, by doing abdominal breathing as practice, we can go back to our calmer self, which was there when we were children, right? Now also, if you will observe yourself, I guess all of us must be in chest breathing, including me, because this is my first webinar. Obviously, I'm in that tension, I'm a little nervous. So even my chest breathing is happening. But if you observe, all of us, like all of you might be in that chest breathing. Now lie down after the webinar is over, lie down, be in abdominal breathing for 30 minutes and let me know. Like, let me know all your experiences. I would love to know what you feel when you did abdominal breathing for 30 minutes. So how to do it? Take a deep breath, expanding stomach without moving chest. So while inhaling, your stomach should go up. You're exhaling, stomach should go to its normal position. ठीक है, no rate of breathing is increased, no kapalbhati, nothing. You just have to do the normal breathing, but take a deep breath, expanding the stomach, not moving the chest. Okay, so you have to just practice it and see what changes are taking place in the body. Now, why I'm taking this as a point in correctional exercises is, now because of lockdown, because of COVID, we all are undergoing through lot of stresses. Like some people have fear of getting infected by COVID. Some people have fear of their loved ones getting infected by COVID. Some people have lost their loved ones. That's why they are in stress. Some people are stranded in some remote locations. They cannot come home. That's why they are stressed. Different stresses. Our stresses level are at the highest point right now. So if you do abdominal breathing as practice, if you stay in abdominal breathing for a long time, let's say 30 minutes, you will see that you will be able to manage these stresses really well. You'll be able to take level-headed decisions after being in abdominal breathing. So try that. And clinically, where we use abdominal breathing is in patients of RA, that is rheumatoid arthritis. If a patient will come to you with rheumatoid arthritis, if you'll ask them since when is it started, they'll say some years, 5 years, 15 years, whatever. If you'll ask them, 15 years back, were you under severe mental stress or trauma? 90% of the patients will say yes, because RA doesn't happen in happy life. Everything was going fine and I'm very happy, and one fine day RA started. It never happens. There has to be some mental or emotional trauma, and that is not managed that time, so that gets reflected on their body and mind, and then they land up in RA, right? So it's a huge psychosomatic disease. So psyche element here is huge. So that we correct by giving abdominal breathing to them. It's a big algorithm after that also, but it starts with abdominal breathing first. So that's how we use it in correction. Now we'll see postures. As I told you, postures is the largest cause of chronic pains, right? So posture is a position which a person holds while doing certain activities, right? Let it be dynamic, let it be static. Now we'll see few postures which we follow throughout the day and how to correct them if you're having pain. Now, first, there'll be some examples. First posture will be standing. We all stand throughout the day. Ladies stand in the kitchen. Many people stand outside in mall and shopping area and waiting rooms. Everywhere we stand. So while standing, mind you, while standing, the distance between your feet should be more than your shoulder length. Okay? Hips should be slightly rotated back, as I've shown in the second diagram. In case of standing in the kitchen, or while working in front of sink, or while working in front of a platform, you have to touch your stomach to that platform, rest on it, and then work. Let it be a kitchen platform, let it be a table, let it be a sink, anything. If you're just standing, then keep the distance and rotate the hips slightly back so that the lumbar lordosis is maintained. And in case if you're going to stand for a long time, keep your heels, you should keep doing heel raises. That is, keep lifting your heels up and down. Let's say 10 times after 5 to 10 minutes. Accordingly, that will maintain the circulation in your lower body. So that's the thing. So that's regarding standing. Now, most important is sitting while working. Uh, this becomes important because more and more of people are sitting and doing their jobs nowadays. Work from home, working from uh, office also. So first point is the surface on which you're going to sit for a long time. It should be slightly tilted forwards. As shown in the second diagram, if it's a static chair, you can put something below the rear end, like a raddi or a wooden block or something, and tilt it, say, by 5 to 10 degrees and sit on it. Again, it helps in, you can see, it helps in maintaining the lumbar lordosis here. Yeah. While writing, the writing surface should be tilted towards you. While reading also, the reading surface should be tilted towards you or right in front of your eyes. Backrest should be taken in between, once in a while, not continuously. Like जैसे हम लोग बेड पे बैठ के ऐसे ऐसे लैपटॉप यूज करते हैं, that is wrong. So that should be corrected. And if you're using computer, screen of the computer should be exactly at eye level. Elbow should be close to your body and then work. So while working, you don't realize your elbow goes away from your body. Whenever you remember, just take it towards your body, closest to your body, and then work. That will take away largest strain from your neck muscles and shoulder muscles. So elbow should be close to your body. Now, how to tilt a revolving chair? If it's a revolving chair, you can give that effect by putting a pillow which is wedge shaped, which is shown in figure number 3. This this you can get it made outside, or you can get it from in shops also. You can put that chair on your revolving chair. So you can put that pillow on your revolving chair, sit on it, and then work. Try that, you will find much comfort. Even if you do it even if you work for a long time, even for hours together. Now, leisure sitting. If you're sitting for a long time while reading book, while watching TV, while watching movie, while traveling, there you don't have to sit erect. You can take a backrest and sit continuously like that. But in between, you have to arch your back and your chest forward and hold it approximately for 1 to 2 minutes. And again, sit relaxed for 10 to 15 minutes. Again, you have to do this. So don't sit continuously in one posture. You have to correct it. Let's say by after 10 minutes, you have to arch your back for 2 minutes, approximately, according to your sitting timing. Sleeping becomes very important because all of us spend at least 7 to 8 hours in this posture. So while lying on back, your head and shoulders should be on the pillow, not just head. Your head and shoulders should be on the pillow. On one side, your shoulder should be down, but should be touching the side of the pillow tightly. There should not be any gap between the shoulder and the pillow. So the neck gets complete support. Neck should remain supported. Okay, so those are the postures. Now, two things about pillow are important. Pillow should be very firm. It should not be hard. It will be hurting the ears, and it should not be very soft. Otherwise, the head sinks in the pillow. So use a firm pillow, and height of the pillow should be maintained. Height of the pillow should be equal to your palmar width, so that whenever you're lying on your side, your neck will remain parallel to the ground. It won't sink inside if it's a thinner pillow. If it won't go up if it's a thicker pillow. So it should be maintained like 4 to 5 finger width of your own hand should be maintained. Like the height should be equal to this much. So that this is what you can follow while sleeping. Now sitting on ground. If you're going to sit on ground, you have to keep your hips on a higher level. म्हणजे पाटावर बसण्याची जी पद्धत होती ती बरोबर होती, पण पाटावर बसायचं आणि legs should be down. Hips should be at a higher level than legs. So exactly shown in the second picture. You have to sit like that and then eat or then work or then sit for meditation. Now for meditation, it's a very fascinating thing which Dr. Sharangapani taught us. You can sit exactly like I told you. Your hip should be at a higher level and legs should be down. But at the same time, if you're sitting at meditation for a long time, you can take a big band which can encircle you. And exactly as I've shown in this figure, the band will go from your lumbar point, lumbar curvature. It will go from below your knees. It will encircle you like this from below your knees, and again it will go back, encircling you. This gives immense relief. You can try yourself. Take a big band or take a big chunni dupatta like thing and tie it as I've shown in this thing. When Sir told us, all of us tried it at home, and it gives immense relief because most of the times when people sit for meditation for hours together, they cannot concentrate on their meditation just because they get numbness, they get pain in back, they get this altered sensation in their feet, they get different kinds of pains while sitting, their feet pain sometimes. So if you can follow this, this is of immense help if you are sitting in meditation for a long time. This you can definitely try. While bending forward, now while bending forward, two things again. You have to keep the distance between your legs. Feet should be wider than your shoulder length. Bend your knees very slightly and bend forward with your arched, with back arched. So people who have done deadlift in the gym, exactly like that you have to bend. Okay? Again, keep the distance between your feet more than your shoulder length. Bend in your knees slightly, arch your back, and then forward and lift. Especially if you're lifting something very heavy. Now, while lifting something heavy, go closest to that part. The object should be very, very close to you so that it becomes very easy for you to lift it. Don't directly bend and lift it. Okay? So this is about lifting and bending forward. Now, carrying weights. While carrying weights, most of the times people suffer from neck pain. Why? So here we are activating trapezius. Trapezius is a very, very big muscle which stabilizes your neck curvature. So here, while carrying the weight in your hand, keep that particular shoulder slightly up. Here it's shown more like it's an exaggerated position. You don't have to lift that much, but slightly lift it up and then walk or then carry the weight. It won't cause any discomfort in your neck and your shoulder. Now comes riding. Yeah, and Pune riding is very, very important. While riding, you should sit straight. Again, the lumbar lordosis should be maintained. Hold the handle with straight hands. Lean on the handle and then ride. Okay? Lean on the handle. So when you lean on the handle, if the bike goes from potholes or from speed breakers, you move horizontally. You move horizontally, and that won't cause any bump or any disturbance in your spine. If you sit very loosely like this, you move vertically, and that causes a lot of discomfort in your back, in your neck. So you have to sit straight, lean on the handle, and then ride. Pillion riders also should sit straight, so the lumbar lordosis is again maintained. They should not be slouching like this and sit. So that is more important. And yeah, driving four wheeler. Driving four wheeler is similar to leisure sitting. You can sit relaxed, aram se while riding, while driving. But after let's say 10 to 15 minutes for 1 to 2 minutes, you have to arch your back and lift your shoulders slightly up. You can do it while waiting at a signal, traffic signal to get over. You don't have to do it while driving. But again, same point. You have to correct the posture in between. You don't drive for a long, long time in the same posture. So that becomes important. Now, yeah. Now we'll come to the correctional exercises. Now the rules of the exercises. All exercises are static. That means there is no movement or there is no repetition in exercises. Almost all. Few are with repetitions, few are not. So those should be static. You have to stay in one position. Second rule is the most important rule, that the patient should be 100% comfortable in the position of the exercise. That is the most important position. If he is getting pain, the correction is not happening, he is not going to get better. So ask patient if he is comfortable in this position, let him hold it. Let it be any position, but he should be comfortable. So that is the most important point in the rules. And then third is normal breathing. You should not hold the breath. It should be continued in the normal way. So these are the rules. Now we'll see few exercises. Now in these exercises, like as I told you, there are different algorithms for different pains like back pain, neck pain, shoulder pain, wrist pain, ankle pain, knee pain. I'll give one exercises for you to try on yourself, and you can try it on the patient also. So these are some takeaways for today's lecture. First exercise is for lower back pain. As I told you, it's a very common exercises. Lift hips up with bend knees, and the patient has to stay where he's 100% comfortable for 2 minutes, and he has to do it 8 to 10 times in a day. Now, with modification, what I've written is most of the times patients say that I'm not comfortable in this position. However low I'm lifting, I'm not comfortable. So then we have to do some modifications, that we can give a pillow below his head. If he's not comfortable, we can shift the pillow to his shoulders as well. So his head and shoulders on the pillow. Or we can change the feet position. We can tell him to keep the feet wider. Or we can change the time. Now most of the times patients say कि आपने दो मिनट तो बोला था, I am comfortable, I can't hold it for 2 minutes. I can hold it only for 30 seconds. I can hold it only for 1 minute. Let it be. Let him modify it according to his comfort. If he is comfortable for 30 seconds, let him hold it for 30 seconds. It's okay. Let him if he is comfortable only for 10 seconds, let him hold it for 10 seconds. It's okay. He doesn't have to stretch it just because we have given it as 2 minutes. So again, time is also modifiable. So this is one exercise for back pain. This is very important exercise for neck pain. As I told you, trapezius is a very big muscle which stabilizes the neck and shoulders. So here we are activating trapezius. You have to take 1 kg weight in each hand, lift shoulders up, stay, where you are 100% comfortable for 1 minute. Again, you have to do it 10 times a day, but here there are again very many modifications in range, how much to lift. Again, weights change, because sometimes people don't feel comfortable by lifting a weight. Then we don't tell to lift the weights. We just tell them to shrug the shoulders up and stay. And if they are comfortable, well and good. They can lift the shoulders up and take them back. Sometimes patient have that slouch posture. So if in those patients, if we tell them to lift up, they might not feel comfortable. So we tell them to lift the shoulders up and take them back, and then they might feel comfortable. So again, weights can be changed, position of the shoulders can be changed, time can be changed. So this is how we go about it. Yeah, knee pain, as I told you, stretching is the most important thing in knee pain. This is the last exercise we give in knee pain. That is, stand with your feet spread out. Okay, spread your legs and stand like that. That will cause stretch from the medial side of your knee. Okay, so you have to stand from 1 minute to 10 minutes once at night before going to bed. There are again many modifications. One of them is position of the feet. You can keep your feet straight. You can keep tell them to keep their feet rotated inside, outside, wherever he is comfortable. So this is regarding knee pain. Gautam, now ankle pain. Ankle pain is mostly because of weight, again, because of plantar arch correction. So what we can do is sit in the chair, keep a newspaper below the feet, and crumple the paper with toes. So that will correct the arch, and that's when it will correct the ankle pain. Okay, so there are again modifications of position of the feet. They can keep the feet ahead. They can keep the feet at thoda sa towards their own selves, and they have to crumple the paper with toes. They have to keep doing it for 5 minutes. But throughout 5 minutes, they should be 100% comfortable. There should not be any pain while doing that. And you have to increase the duration by, let's say, 10 5 seconds, and go up to 20 minutes. But not every day. He has to again increase it according to his own comfort. So that's regarding the exercises. Now, in case of any other joint complaint, exactly like that, we can formulate the exercise according to the surrounding muscle by calibrating the surrounding muscles of that particular joint. Let it be a thumb joint, let it be wrist joint, let it be shoulder, anything. Okay? So that's all for today. So stay corrected and stay comfortable. Thank you so much. And I would like to thank Karkare sir for giving this wonderful opportunity. And when Dr. Sharangapani also came to know about it, he also became very happy to know that all the homeopaths are eager to, learn something about correctional exercises. So he also conveys his wishes. Thank you so much.